Hello, everyone. I'm Richard Roll, and you're watching Spotlight Local TV. Today on Spotlight Local TV, I will be talking about a problem that affects more people in America than diabetes. But 90 to 95% of the people who have this problem don't know that they have it. I'm delighted to welcome to Spotlight Local TV today Dr. Rob Burwell. He is the director of the Burwell Center for Better Sleep in Claremont, California. Rob, thanks for being with us today.
Well, I'm real pleased to be here. I hope to get some information out to the public that just isn't getting there.
Rob, let's start by asking you, when people are faced with sleep apnea, how do they know that they have sleep apnea?
The most typical reaction is daytime sleepiness, waking up unrefreshed, and their bed partner saying that they either snore and or stop breathing while they're sleeping.
So they're waking up because they're having trouble breathing during the night. They may not be aware that they're actually waking up, but they are feeling sleepy during the day. Or also they have a snoring issue, which their spouse basically or their partner says, hey, you're snoring too much. Is that right?
That's correct. Snoring affects about 40% of the population, and it's been estimated that by 2016, 60% of the new homes will have 2 master bedrooms because the bed partners can't sleep together. One of them snores too much.
Our mission at the Burwell Center for Better Sleep in Claremont, California is to help people find the best solution that they can live with to be able to find a good night's sleep and save their lives, really, because it's really saving lives one breath at a time. Is that right?
That's sort of my little mantra, saving lives one breath at a time. Yes, if they can't tolerate a CPAP, then the only other alternative there's 3 alternatives. One is surgical, one is some sort of an oral device, and one's the CPAP. And CPAP is best by maybe 10% or 15%, depending on who you talk to. But the oral devices are the least invasive, the most tolerable. Their compliance rates are far higher than CPAP. Most people find after a night or 3, it's just not an issue. So
let me ask you, what is the experience like when somebody has determined that let's say a physician has prescribed that they need a solution for sleep apnea, and they've had the CPAP machine and they're not using it? What's the best thing for them to do, and how would you recommend that they find an alternative solution?
Well, the best thing, in my opinion, is an oral device. And they have to be provided by a dentist. A physician cannot legally provide an oral device. And the patient can go online to the American Academy of Dental Sleep Medicine, of which I'm a member and diplomat eligible, and find a dentist in your local area who has adequate and extra training in dental sleep medicine to provide a device. The device is very similar to the procedures of cardiopulmonary resuscitation. When you're doing CPR, you're taught to tip the head back and pull the lower jaw out, and that pulls the tongue away from the backside of the pharynx and opens the airway. That's what these devices do. They slowly and gently pull the lower jaw forward, pulling the tongue off the back of the pharynx, opening the airway, and allowing these people to once again get a good night's sleep.
Dr. Rob Burwell in Claremont, California, helping you understand how to deal with sleep apnea and how to solve this very important problem. Rob, thanks for being with us today on Spotlight Local TV.
Well, thank you for allowing me to talk. I appreciate it and enjoyed it.
Wonderful. Stay tuned for more editions of Spotlight Local TV, where we are helping you make the best decisions in your life. For Spotlight Local TV, I'm Richard Roll.